So Texas Children's Pediatrics has been and will continue to maintain safety for all of our patients, families, and staff. We do pre-screening before our patients are coming into the practice. We give masks to all of our families as they come into the practice. All of our staff wear masks, and again, our providers will wear full PPE for patients that are considered positive COVID screening. We continue to have our social distancing. We don't allow patients to be in the waiting rooms. We will bring them straight into exam rooms to minimize any exposure risks. So all of our Texas Children's Pediatric practices are open for well child visits now at all ages. We have just opened up our My Chart for well checks as well. Now, in order for us to be able to continue screening those appointments for safety, appointments made will be made at least 3 days in advance so that we can reach out to the families and be sure that those families and the children are well before coming in to, again, minimize exposures. But this will now allow families with children of all ages. We had been doing children up to the age of 4. However, now this will allow patients of all ages to come in for their well checks, and we certainly do encourage that you do so. It is critically important that all of our children continue to receive their vaccinations during this time. We all worry about COVID-19. It is a serious, serious disease, but there's so many other vaccine preventable diseases that are equally, if not more serious for our children, and we really want to be sure our kids continue to be protected for all of those vaccines. For those patients who we were not able to do earlier on because of our age restrictions, we certainly encourage you, and we'll be reaching out to your families to bring them in and get these kids vaccinated. So we have instituted telemedicine both through video and through telephone calls. Going forward, we are rapidly expanding our telemedicine video capabilities, and we'd like to be able to offer the ability for all of our patients to be taken care of either through a virtual visit, through an e-telephone or an e-video visit, or in person, depending on the situation. Again, when you call to make appointments at our practices, we'll be able to ask the questions that we need to know, and we'll determine what's best suited for your child to be sure that we're maintaining safety at all times. For My Chart now, we can do e-check-in for patients coming in ahead of time, so that all that can be done without there being any paperwork at the front desk, and again, the family can be taken straight to the exam room.